Hey guys, Dr. Travis McDermott, Vegas vet here. Once again, coming at you with some educational content. Today we're going to talk about hydrotherapy, what exactly that is, what it can do, and how do you do it. So hydrotherapy is just more or less a fancy word for we're going to take a wound on the body and we're going to spray it off with water for a certain amount of time. It's a little more complicated than that, but not much more. In my experience with wounds, I've often seen that we can heal up wounds in half the time with hydrotherapy. So it helps us battle infection and helps us develop healing tissue. So what we're going to do is we're going to have our patient here. Our patient is a polar bear. We didn't have any patients that needed wound care, thank goodness. And we didn't feel good about just spraying a random dog off with water. So we have our patient here who is a no-named polar bear. And we're going to have a wound here on the front paw. And what we're going to do is we're going to start the process. So we do have a fancy dancy nozzle here, but you can use your sprayer on your sink. You can use a detachable shower head. You can use the hose outside for a big dog. And this is all you're doing. You're just going to spray the area off with the water. For usually I'd say about 10 to 15 minutes, preferably twice a day. And you can see there's a pretty good amount of pressure here. I mean, we're not just drizzling it over, there's pressure. And the reason why we need that pressure is that it's gonna do two things. It's gonna stimulate the tissue that's there to heal. It's also going to kill bacteria. So obviously it's not the only antibacterial method that we use, but it is helpful in keeping it clean. So we're going to do that 10 to 15 minutes, like we said, and focus on these areas. Now, this can be used for small lacerations. It can be used for big things. Now, I wouldn't recommend it if the intestines are hanging on the body. It's probably not going to help. But I have had patients that, for example, one in particular, that was about a 30-pound dog and was attacked by a large dog. It separated the skin off of the body, and all that skin died. There was probably a good foot or so, maybe a foot and a half of tissue in a circle that was missing. It took about 2 months, but we got the scar all the way down to the size of about a nickel. And hydrotherapy was the biggest contributing factor, in my opinion, to that besides antibiotics. So, and that is important to note that many of these dogs and cats don't go as well with the hydrotherapy as dogs, but it is, obviously if you can do it on a polar bear, you can do it on a cat. So, but many of these guys, if it's bad enough to need hydrotherapy, a lot of times it's bad enough to need antibiotics. Not always, but take that into account. If it is a more than a very minor laceration, you're going to want to see your vet and get some antibiotics and make sure we're keeping it clean that way. We're just, like I said, continuing this process. We're going to fast forward and say it's been about 10 minutes, and we're going to go ahead and stop. And the next step that we're going to do is we're going to pat this area dry with a towel, because we don't want to leave wet fur and wet skin there, just because it invites dirtiness, it invites bacteria. So we're going to dry it off nice. I prefer to pat them dry as opposed to rubbing them dry. I think, all the work we've done by stimulating the tissue there, we can rub some of those healing cells off actually by rubbing and being too aggressive with the rubbing action. So we're going to dry this off, and then the next thing what we're going to do is we're going to take like an antibiotic cream. We use a product called silver sulfadiazine. It's used a lot in horses. You can use it, you can probably pick it up in any feed store. But it is an antibiotic cream. You can use like triple antibiotic ointment like Neosporin and put it on there, and that'll help kind of fight and combat any infection along with the antibiotics you're giving because you went and saw your vet. So the next big part of this, and that looks really gross in that fur, the next big part of this is going to be making sure that we're not licking on this area. So most people hate the cone on the dogs or cats, but we don't do it just because we want to torture them or just because. Most wounds will not heal up if the dog or cat continues to lick on it, and that's what nature tells them to do, is to lick it. So we need to put a cone on. You can pick these up from your vet. You can get them from Petco, PetSmart. We have the hard plastic ones like the ones you see, but if you go to Petco or PetSmart, they have some pretty cool ones that, and any pet store for that matter, have some pretty cool ones that are soft, and some of them don't even come out at the angle like this, and they actually come out to the side, so it doesn't take away their peripheral vision, but it can be really useful. So I'd like to thank our polar bear here for helping us out, as well as Brittany for helping us out with as a hand model. But just to kind of show you what we're talking about. And if you're watching this because I've told you need to do hydrotherapy on your pet, you now know what I'm talking about. And if anybody has any questions, please let me know. You can comment here on Facebook, anywhere, and just let me know, and I'll see if I can answer any questions you might have. But it's relatively straightforward and very helpful. I hope you guys found this informative. Once again, Dr. Travis McDermott, Vegas Vet. I'll talk to you soon.